Hello, everyone. To begin, my name is Lamarq Patterson. To my right is Kyle Johnson, and next to him is Jacob Crum, and we're going over the carpal tunnel syndrome, specifically the Phalen test. To begin, we'll talk about the accuracy of the provocative test. To give a little background of the article, listed there are the authors who have made the article and the journal that is provided as well. To start with the specificity, this is more of a test for ruling in, and it also was really good for true negatives. For these numbers, they're pretty below average, 0.33, which isn't necessarily good. But if you go into sensitivity, which is good for ruling out and true positives. It's right around average, 50%, which could be good, but with that, there would be further tests to be diagnosed afterwards. And to go into the next slide, to give a little clinical background and scientific background of the Phalen test itself. The Phalen test is established by history and physical examination. It's more of a active process for the patient. It's very inspection worthy for the care provider. It was first described and performed in 1957 and is now a very popular and commonly known carpal tunnel syndrome test. Whenever people hear about the tunnel syndrome test, that's usually what they think about is the Phalen test. It's used to evaluate the median nerve compression in the patients who may have carpal tunnel syndrome. So if you look at the picture to the right, you can tell when the both hands are facing towards each other and there's wrist flexion at 90 degrees. A positive test would occur when there is a feeling of numbing or aching in the median nerve within 1 minute of doing this action. For the study objectives and hypothesis, the objective of the article was to measure and compare the diagnostic accuracy of the Phalen test to three other commonly used provocative CTS tests. The other three tests are known as the Tinel, the Durkin, and the Fadurkin. Fadurkin is a test that was it's combined with the Phalen and the Durkin test, but since we're only specifically looking towards the Phalen test, we're only going to look towards that. To get into the hypothesis of the article overall, to know the hypothesis with that was there were no existing difference between the proportions of the positive test results for all four tests, which means that there wouldn't be, for instance, with the sensitivity being at 0.50, it should be the same mainly for all four tests.
All right, so to get into some of the people that participated in this examination of all four tests, there was 55 patients and they used 85 hands of those 55 patients. So each patient didn't have both hands tested. It was more dependent on the symptoms that they had. And they had a median age of 59 years old, I think the youngest being about 40 years old and the oldest being about 65 years old, and averaging right about in the middle there at 59. And then there was 39 females that were tested and 16 males, so a lot heavier on the female side. And just as a side note, to compare with some of the patients that were tested, 25% of those patients tested with carpal tunnel syndrome also did have diabetes and were previously diagnosed before the test for that. So to figure out what kind of symptoms they were dealing with previous to doing any of these four tests, they used a electrodiagnostic evidence test or EMG test to check the muscle activity in the wrist and thumb area to see what kind of symptoms they were already producing. Of those 85 hands that were tested, 9 of the hands had no symptoms, 20 of the hands had mild symptoms, 19 hands had moderate symptoms of carpal tunnel syndrome, and lastly, 37 of those hands had severe cases. And so they were looking to compare the results of that EMG test to the 4 different types of tests. So getting into the little bit more about the Phalen test was that its main use is for basically to find that there's a good initial indication that the patient is presenting with carpal tunnel syndrome before they go on to do further testing beyond that point. It's a good starting point to diagnose them. So, main couple things about the Phalen test is that you take both dorsal sides of your hands and push them together, and the patient's instructed to hold that position for at least a minute. During that minute, they'll be talking with the examiner, and we'll be notifying them of any signs of numbness or tingling. And that tingling can range anywhere from their thumb all the way to their medial half of their ring finger, because of the pressure that the test is putting onto the medial nerve. And this can also be in their pointer finger as well as their middle finger, or even on their kind of medial side of their hand. And then the golden standard for carpal tunnel syndrome is a nerve conduction test, which is very similar to the EMG that they used in the initial testing of the symptoms. But the difference there is they're testing the actual specific median nerve instead of just the muscles that were in the hands. Okay, and then the main findings from this test, on the left there, you can see a resultant graph comparing all four tests. And as you can see, for the most part, they had very similar results in some areas, some doing better in sensitivity, some doing better in sensitivity, but overall not an extreme amount of deviation across the thing. The Phalen test in comparison to the EMG, they had 38 true positives, 3 true negative tests, 6 false positive tests, and then 38 false negative tests. And then, as Lamarck previously mentioned, they had a sensitivity of 0.5, which is not great, and a specificity of 0.33. As well, they also provided what their positive predictive values were. So it had a high predictive value of a positive test and a 0.86, and a really low probability of a negative predictive value, which was 0.07.
All right, on the test accuracy. So the Phalen's test shows better sensitivity than specificity with a sensitivity of 0.5. It correctly identifies half of the people with carpal tunnel syndrome, making it fairly reliable for ruling out the condition when the test result is negative. However, its specificity is 0.33, which indicates it only accurately identifies 33% of people without carpal tunnel syndrome, making it less effective for confirming the diagnosis on its own. Due to its low specificity, it may generate false positive results, suggesting caution relying solely on the test for diagnosis. Therefore, while Phalen's test can be helpful in ruling out carpal tunnel syndrome, it is not strong enough to confidently confirm the condition independently. And for test reliability, the reliability of the Phalen test can be seen as moderate overall. And when it comes to sensitivity, which measures its ability to accurately rule out carpal tunnel syndrome, the test shows moderate clinical usefulness with a kappa coefficient of 0.5. This indicates reasonable consistency in identifying individuals without the condition. However, in terms of specificity, which measures its ability to correctly rule in those with carpal tunnel syndrome, the test demonstrates poor clinical usefulness with a kappa coefficient of 0.33, suggesting limitations in accurately diagnosing the condition. For observer reliability, especially within the same examiner, which is intra-rater reliability, it tends to be more consistent than using different examiners, which is inter-rater reliability. This consistency may be due to the influence of the examiner's experience and their skill on using the test. And for study limitations, Phalen's test, which is a common tool for diagnosing carpal tunnel syndrome, encounters several limitations and potential biases. Firstly, it relies solely on electrodiagnostic studies as the reference standard, which might introduce bias as there are alternative methods like CTS6 or ultrasounds. Secondly, incomplete data from patients who didn't complete electrodiagnostic studies could skew results, particularly in patients with less symptoms. Furthermore, conducting multiple tests on each patient raises concerns about confirmation bias. Even though significant differences were found among diagnostics tests, selection bias might also exist since patients not deemed symptomatic enough for testing weren't recorded. Although analyzing data by hands instead of patients could lead to interdependency, using patients as the unit produce similar sensitivity and specificity results. And these factors highlight the need for cautious interpretation and further investigation of Phalen's test reliability and accuracy.
Okay, so our first big conclusion from the reading and from the testing about Phalen's test is that it's a great initial test that can be done to see if the patient actually has any sort of symptoms, any sort of numbness, any type of tingling in their hand. But from that point forward, if they do have a positive test with Phalen's test, they should go get further testing. And even if they have a negative Phalen test, they should go get further testing because it really isn't that great at confirming it, only telling you whether or not it may be present in the hand. So a nerve conduction test or an EMG test following that initial Phalen's test would be highly recommended.
All right, so yeah, the Phalen's test exhibits higher sensitivity at 0.5 than specificity in diagnosing carpal tunnel syndrome, so is more reliable for ruling out the condition than confirming it. And the test demonstrates moderate overall reliability, but with inter-rater reliability showing more consistency than inter-rater reliability. However, limitations and biases such as reliance on electrodiagnostic studies as reference standard and potential confirmation selection biases highlight the need for cautious interpretation and further investigation and its reliability and accuracy.
Perfect. And that's the end. And thanks for coming to our Phalen test presentation.
Thank you.